Welcome to Breast Intentions, the podcast where we take off the bra of expectations and dive into honest, empowering conversations. We're your hosts, Nadine and Cynthia, two Canadian girls who swapped snow boots for flip-flops in the Cayman Islands. This is your space to feel seen, supported, and a little less alone. So grab a cup of coffee or a glass of champagne and get ready for your weekly handful of truth, wellness, and empowerment. Our next guest is Dr. Gary Montemayor, an award-winning quantum medicine researcher and holistic health pioneer. With a PhD, DNM, and a passion for blending ancient wisdom with cutting-edge science, his work in energy medicine, heart-brain coherence, and consciousness is transforming how we understand health and human potential.
Well, today's episode, we have a very special guest, Dr. Gary Montemayor. Welcome.
Thank you.
Thanks for coming. So why don't you give yourself a little introduction and tell us?
I started off in allopathic medicine, which is Western medicine.
Okay.
I went to medical school in Monterrey, Mexico, and ended up doing my clerkships in the South Bronx in New York at a place called St. Barnabas Hospital. It was a Cornell teaching hospital. And it was a time when AIDS was just being introduced. And this particular hospital had more AIDS patients. So they're actually trying to find out what was the cause of it. And so one of the things that happened, because it was somewhat of a life-ending diagnosis, is you got to integrate with the patients in a very deep way, in a very human way. And I was 26, so I just, getting to know that type of the world, it had a profound effect on me. I decided after that not to go into allopathic medicine, even though I was pretty much completed my studies. Instead, I became a submarine pilot. And
Really?
Yeah. I actually made some discoveries and am now a fellow of the Royal Geographic Society and a fellow of the New York Explorers Club, and that has been a real honor. It's been some of the highest honor. And after that, I became a diplomat, and I was served here in Cayman for 12 years as running the U.S. consulate here. And after that, I wanted to go back into medicine in a way, because I found energy medicine, and I found it to be really fascinating. So I wanted to know more. And then I found out about quantum medicine. And, the whole thing about, quantum physics, and it's just so unexplainable, and it's the newest thing going down. And just the name was attractive.
How long ago was this?
This was about 3.5 years ago.
Oh, okay.
Yeah.
Okay.
And so it is recent. This is my last career change, So I studied under really great names, Joe Dispenza, Bruce Lipton, Amit Goswami, who's a great quantum physicist. And he really taught me everything about consciousness and the 5 bodies of consciousness, which we study in quantum medicine. And it was so different. As allopathic medicine, we only studied the body, the human body, and it was molecules, organs, systems, the brain. That's just what it was about. And consciousness was a decision that you make, and it ends right there. So that's what it was. It was very mechanical. The quantum medicine is much different in that it works with frequencies and energies, and we do something called measuring the mystical in my little lab, and that's what we use modern metrics to measure ancient modalities. We'll even measure things like acupuncture, where I can real time see, if somebody's on the spot, because we'll see on the graph, that, they're right on the spot. There's healing going on, or there's not, which is really important. And with energy medicine too, we can actually measure people in real time, but we measure them before treatment and after the treatment to see if there's any changes. And so it's not always subjective. We can actually see physiological changes, and that's really important.
Okay. So for those who are listening, how do you break down exactly, like, how do you break down quantum medicine to people? Like, how do you actually explain that?
Okay. Outside the physical body, we have what's called the human biofield. It's also called auras, and it's called the qi in traditional Chinese medicine. And Ayurvedic medicine is called prana.
Oh, yeah.
And all this energy up there, uh, I studied under a man called Rupert Sheldrake, and he was a Cambridge biologist that came up with something called morphic resonance and the morphinogenic field. So he calls it the morphinogenic field, and it is the blueprints to every cell in our body. It is the blueprints to every organ. It is the blueprint to every system that we have. And anything that affects that blueprint affects our very DNA, and that's called epigenetics. So when we go to a practitioner and we go for energy healing, we go for acupuncture, we go for herbs, we go for traditional Chinese medicine, any of those will be treating only the vital body.
Okay.
Yeah. And so we move over to the mental body. And this is where it gets really fascinating, because the mental body has two chambers, as you can see right here. One of them's thinking and one of them's thought. Thoughts are nouns. They're passive. We always have thoughts. We always will. Thinking's a verb. They're active and they're a choice. The only time that we think is when we think about a thought. And that's really important, because we have 60,000 thoughts a day. 95% of them are the same thoughts we had yesterday.
I just heard about this.
Yeah, 85% of them are negative. 7% of those are judgments in other people, and the rest are judgments on ourselves. And then we beat ourselves up.
Mm-hmm. Oh, yeah.
We beat ourselves up. We don't even realize if those programs are running underneath. And 50% of those thoughts that are there are actually lies that we have told ourselves.
Mm-hmm.
And we live our present moment based on past lies. And so those are the things that we treat when we treat the mental body.
Okay.
And so when we treat the mental body, we use things like meditation. And when you come to my lab, we put on an electroencephalogram, and we let you see your brainwaves, and we talk about each and every one of them. And then we let you hear your brainwaves with a neurofeedback, and it sounds like rain. And after we get the rain to slow down by bringing you to the present moment, teaching you how to breathe, you actually hear the rain starts to slow down. And when you, all of a sudden, when you get into the deepest state, you start to hear birds. And that's when you've opened the door to the subconscious. So they can see how, they hear it, they've seen it. How am I getting to this spot? And they know how to do it. I mean, I've had people come in and say, I've been meditating for 20 years, and they just never got it.
Mm-hmm.
You know, they can't get past. And I have people say, I've never meditated, and they're just amazing. You know, they just know how to take to it. So it really is. And I work with everybody to bring them up to standard, because, you know, when we talk about the mental body and we talk about thought and thinking, you know, this is so important to be able to calm that down. There's other ways, ancient ways. Yoga is another way. When you're breathing and doing that movement, you go into a state where the busy mind slows down.
Mm-hmm.
And that works. And more recently, we're looking at hypnosis and neurolinguistic programming are the more modern types of modalities we use to treat mental body illnesses.
Okay.
So it's pretty fantastic. And we put brain waves to every one of these particular bodies. And when we talk about thinking body, we have beta, and that's where we are now. Beta waves are come in three types. When we're chilled and talking, we're in low beta. If you're in a classroom and the professor says, get your pen out, we're going to have a test, and it's kind of a mid beta. But if you walked into a room and a lion showed up, and, you know, that's high beta. It's a fight or flight.
Okay.
Yeah. And so that's what we start getting. While thoughts are alpha. Alpha is very creative. It's very, it's like meditation, almost like daydreaming, looking out the kitchen window and just like, oh man, this is great. Just having those, you know, just mind's clear. You're just kind of zoned. And that's alpha. And that's a real good state to be in. And because we get a lot of creativity, and we're not using our thinking mind to be too busy. We've quieted it down. The next body is called supermental. And that's what we call supermental intellect. And it's knowing without thinking. It's knowing without thought. It is quite one of the most amazing bodies because it's the home of archetypes: love, caring, empathy, joy, appreciation, gratitude. All that lives in this one space, and it's very pure. There's no lies in there, but it also has a connection, direct connection to karma, ancient wisdom of our ancestors, morphic resonance, which is memory of our ancestors. And there was an experiment called the 100 Monkey Experiment. And this was very interesting because they were doing studies on monkeys on this island. And they noticed that one of the monkeys started peeling potatoes and washing it. And then the other monkeys started doing the same thing. And so they moved their research to another island, and they started seeing monkeys starting to peel their potatoes, their sweet potatoes. And so that was very interesting because what would happen is that collectively they were able to transmit what they were doing to another group of monkeys telepathically.
Okay.
Yeah.
Oh, wow.
Yeah. Very interesting.
Yeah.
Very interesting. And then the last body is the cosmic consciousness, or the highest state of consciousness that we have as individuals. And we know about it subjectively in the fact that near-death experiences happen, and people say, they saw the light, Golden Gates. They wanted to stay. It was the most beautiful place, but they were told it wasn't their time. We also get it through something called DMT, dimethyltryptamine, and what that is a psychedelic that we actually have in our own body. So when we do a pineal gland meditation, when we actually do this particular type of meditation, we make the pineal gland vibrate because it's made of crystals. We actually have these crystals in our brain, and it's really tiny, about the size of a grain of rice. And whenever you affect pressure on those crystals, it causes a piezoelectric effect, and it like raises an antenna and start to connect to the higher state of consciousness.
Okay.
Mm-hmm.
And would you say that in terms of your clientele, are they females, males, split down the middle?
Most of them are females, but I'm getting a lot more males now, which I really like.
Yeah. And then the average age of a woman, would you say that you see a lot of women midlife going through? Actually, maybe I'm going to back that up just to ask you another question. The types of people that are coming to see you,
Mm-hmm.
where are they currently in their life when they're coming to see you? Are they just wanting to find out more about who they are? Are they in more of a medical state that they're just looking for other answers?
Yeah, there's some that have that come. They have a medical issue,
Okay.
or something deeper,
Okay.
and they're looking for the source, and they don't want any more pills.
Okay.
They don't. They've tried all that, and so they come to me, and we work in a systematic way to be able to look for the deepest way. And we teach them a lot. What we're teaching you now is about, the 5 bodies and how they work, and where to align us in where am I going wrong. And they show, and then we do energy medicine and spinal flow as well. And at the end of it, they all feel real good. But I would say, and they keep coming back. I'll make an appointment if they want to, but I want to see if they're on a journey and they're getting better by coming to see me. I don't want to force them to come back. I want them to come back on their own.
Right.
And they do.
Mm-hmm.
They're just regulars. They just keep coming back, and they just say, I feel so good after I feel great after, my symptoms have decreased. I'm feeling better. But they go home to the same buttons, the same triggers, the same emotional environment, the things that set them, into that frenzy anyway. So we start to teach them about things like heart-brain coherence, which is really important to get them to bypass some of these triggers that are there. And they're having success with that. But it's, a lot of times it's hard to stick with these things, but I do have people that have had, certain disorders, and they've stuck with it, and it's just gone to their doctors. You'll surprise. So it's always good to hear that.
So then you mentioned heart-brain coherence. What exactly is that? Is that heart math?
That is heart math.
Okay. I've heard about this.
Yeah. Yeah. Heart math is very interesting. Your heart has a brain. Just recently, we found out that the heart has about 80,000 neurites. That's like gray matter and white matter. And it actually talks to our brain more than our brain talks to our heart. And we're really surprised with that, and that it actually has, it stores memories as well. And so when you're in heart-brain coherence, you actually create something called a torus field, which emanates from your heart. And you have a field that emanates from your body as well. But the heart torus field is 5,000 times more intense. And that's really important because as we create this heart-brain coherence through a technique I can teach you in 5 minutes, we increase this particular torus field out about sometimes up to 9 feet out from our body. And people notice it. They don't actually see it, of course, but they feel it, or they look and go, wow, what's going on with you? You look great, and it is something, the torus field is emanating this frequency. And it also, wherever there's a frequency, it attracts a similar frequency. In physics, we call it constructive interference. And when two frequencies meet of the same wavelength, they double in size. So if you just put a person in front of you, let's say you met somebody and you have that attraction and the two waves, all of a sudden you get that is the doubling of the size of that frequency. And we call that the universal law of attraction.
Okay.
And it's fantastic. And it has, and it all comes from heart-brain coherence.
Is this the same as like having high vibes and low vibes, and like people you meet might be on a lower frequency than you, and you might not kind of get along with them, or vice versa, but you are kind of attracted to other people who are vibrating at the same frequency?
Absolutely. Absolutely. This is called constructive, destructive interference. When a wave of a higher size and a lower size come together, the higher side usually goes lower,
right.
higher.
Okay.
And so they try to bring to the same frequency. And so that's why they say, choose your friends wisely.
Yeah.
Because they
bring you down.
That's right.
Yeah.
They bring.
So what you're saying is that you can never bring someone else up. You will end up going down.
Yeah. They're a lot of times, we call them energy vampires.
Energy suckers.
Yeah.
Yeah.
And there's nothing you can do for them. I mean, that's what they do. They have a behavior pattern that's conditioned of something that happened in their past where they live in the present. And that's, and that's a behavior. And it's also a character. So a character trait. And so you just try to stay away from those people.
And then give them your business card.
Yeah, give them yours. But you could I've witnessed that for sure. Like when you leave a meeting with somebody like that, or a dinner, and you're just exhausted, and it's because they've literally sucked the energy. It feels like they've literally sucked the energy out of you.
Absolutely.
Yeah.
Absolutely.
But then there's also other people that are like perfectly fine.
Yeah.
And getting along with them.
True.
Well, so then they just vibrate at the same frequency?
No, not at all. They've learned to,
Okay.
they have
okay.
Yeah.
really, really strong boundaries where, nothing seems to bother them, seems to bounce off. When I do energy work, sometimes I'll feel it and I'll have to, shake it off. And there's ways to do that, Qigong ways, Tai Chi ways, and Ayurvedic ways. And, I work with that. It really works. And I wear this as a reminder of keeping those away.
Oh, yeah. We talked about that.
Yeah.
What is that, Gary?
It's something I got off eBay, but I liked it. And I had it, blessed by a shaman who worked on it, and to keep evil spirits away and energy suckers.
Yeah. From a crystal side, they usually say black tourmaline as well.
It's a black diamond. Yeah.
Okay.
Yeah. It's very powerful as well.
Yeah. I used to only work with people over email. So I never saw them and I never talked to them.
Right.
Everything was just over email. And then when I moved into another area of my coaching, everything was all on Zoom or down here meeting people face to face. And all of a sudden I had this feeling come over me where it was like I drank 18 cups of coffee and I couldn't seem to settle my system. And I actually ended up getting a Reiki treatment. And that was one of the things that kind of helped at that moment. But I had to do a lot of really, really big, deep searching as to what would help me ground myself. And so they talk a little bit about like going in the sea because of the salt water. Is that what?
Grounded.
Yeah, putting your feet in the grass. And a woman taught me many, many years ago to just wash my hands in between each of my calls. They sound a little bit funky, but it works. And I can go from one call to the next. And everyone's different because you're just dealing with different personalities and different issues that everyone's going through. And I was absorbing all of it.
Right.
And now I can go from one call to the next. And it's that same thing. I set boundaries. And but I was trying to actually explain this to someone the other day, where you almost just build up this field around you that you can't let people in. Of course, there's going to be certain people that are going to trigger you and kind of go through those, but very, very few and far between.
Yeah. Healing Touch is one of the programs I work with, and it's leading energy medicine in the world. And they use it in American and Canadian medical schools that are very progressive, and nursing schools where they're teaching them how to heal with their hands, and they're being able to back it up with science. So what happens is we make an assessment of really what's going on, and then I work with them to energetically to be able to balance whatever's off. And a lot of times I can feel it. But one of the biggest misconceptions about energy medicine is that it's an event, that they're going to come in here and magically walk out feeling better. That's not quantum medicine. This sometimes it took you a while to get there. It's going to take you a while to get better. Some people do it faster than others. But I've had spontaneous healings where people have come in and, with a cold sore, and that night they call me and go, my cold sore is gone. What did you do? I just got it today. And it really wasn't me, it was them, because your body has an amazing capacity to heal itself. And so that's one of the things we look at is, I channel energy. And what I do is I put an electroencephalogram on my own head. And they've already learned what it means to hear birds, because it takes you really deep. So in the room while I'm doing that work, they hear birds and they know that I'm in a deep state. And we'll find, because we have monitors on them, that my pulse rate and their pulse rate and their respirations and my respirations are the same. And that's really incredible, because we're into something called entanglement at that moment, where, it's just energetically we become one. And they heal that way. It's very powerful.
When you say that you can feel their energy is off or something is not well, what do you mean by you can feel that?
Well, I've gone, every person is different the way they react to you, but you will feel energy when you do this a lot. And one of the things that I use this example is I was doing energy about 6 inches above the body, and my left hand, my thumb started clicking, and I didn't know why. And when we had the session was over, I said, we worked on your left breast. She goes, yes, I just got diagnosed with cancer there. I didn't tell you because something I'm not dealing with right now. And so you can feel it. Your body feels it when you're energetically tuned in. And so that is, yes, you can feel the energy.
So it can have this physical manifestation in you.
Absolutely. Absolutely. When you're in a deep state, you start to feel these things.
Right.
And know where in the body to go.
Okay. What is a common misconception about energy medicine that you'd like to clarify?
Oh, that it's woo-woo.
Yeah.
It's waiting for that one.
Right. Is that what people kind of go, oh?
Yeah, that's one of the things that is probably my biggest driving force about teaching people, is that we're using modern metrics to treat these, to gauge these ancient modalities like healing touch and Reiki and some of the others. But I learned from people, my program with healing touch is 2 years long, and there's other schools that are 4 years, and you have to go there and stay there. You live there. I mean, they're intense. They're real schools of healing. But then I've heard people say, yeah, this lady came down and we're Reiki practitioners. We did it in a weekend.
Yeah.
And that really dilutes the people who really know. And that really is not good, for energy medicine. And that's where the woo comes from.
Yeah.
Because they're telling people, oh, you might have cancer, you might have that, which is kind of a nocebo, meaning if you tell somebody they have something, they may believe it and then they get it.
Right.
And so that's one of the things that we do. So healing touch is used in some ICU units and chemotherapy units, because we've learned, and this is really important for people who are on hormone replacement therapy, is that we learned that this particular type of energy modality helps the medication work better. And that's scientifically proved. And they've done it with Reiki masters and healing touch professionals, that they'll go in there and they'll work on these people. And that means the amount of time that you have that medication is decreased. And that's what you want. Because one of the things about integrated medicine is we want to integrate with allopathic medicine. That's why I feel so strongly about it, because I was in allopathic medicine. And if I break my leg, I'm going to an allopath. I'm not going to an energy healer, right?
Right.
If I have an infection, I want, antibiotics.
Yep.
But it's the chronic illnesses that we have. It's the irritable bowel syndrome, the Crohn's disease, the things like that, are really can be managed and helped with some type of energy medicine.
Mm-hmm.
And then we look at things like not only does it physiologically help the body with the medication, but it also helps dilate the glands that secrete hormones. So it balances the hormones, and it's something we call homeostasis. So it helps you bring it to homeostasis. And I think a lot of it's connection with another human being. Somehow that when somebody comes to see me for my program, it's 2 hours is the minimum I stay with them. And that's if they're, they've been here. Sometimes it's up to 3 hours. I've gone further.
Okay.
And the reason why is because, just hearing their story, you need to hear it, and that they need that, there's some deep connection that they need.
Yeah.
In a very spiritual way and a very energetic way.
Mm-hmm.
And it's very easy for me to do, and I enjoy it. And a lot of people say, well, don't you get burnt out? At the end of those sessions, I am like this. I can't stop talking. I am so energized because all I've had is energy pouring through me into them, and they feel better and I feel better, and they look 10 years younger when they walk out of there. So it's really pretty powerful, pretty fantastic.
Mm-hmm.
It is.
Are there any other myths about energy medicine that might mislead women who are exploring health management alternatives during midlife?
Yeah, well, like I mentioned before, it's energy medicine is not an event. It's not a one-time treat all.
Yeah.
And if they're coming there for an experience or an event, it's not, I don't do that.
Yeah.
And a lot of practitioners who, know this energy medicine don't do that as well. But
so I might say, come to you for hot flashes or night sweats, and might not be able to leave that day going, wow, I'm never going to have a hot flash again.
That's right. That's right. But what they do learn is that, we start to look for the source in the 5 bodies. We don't just treat the physical body. The physical body, in that case, has a hormonal imbalance. And so, we look to the vital body. But a lot of times, these hot flashes and things could be triggered by something deeper, because it does vary. And not everybody has them that bad, and some people do. So our belief is that, we can go into the mental body and start looking for solutions there. And a lot of times we'll regress back into, what they talked about. And we'll talk about their childhood. As we go through the brain waves, we'll start to talk about alpha, when the ages of 4 to 8 years old is when you're the most susceptible, and you're just downloading information. And that's when they say, show me the 7-year-old, I'll show you the man or the woman, because you've already seen the character built by their environment. And it's and so what we do with that is we try to look for that, and you start to get the stories from people. Oh yeah, well, this is what happened when I was that age. I saw this and it's really affected me. Or they just have a mindset that is important. And when they interface with the world, it can cause a disorder, unbalance. And that unbalanced energy can turn into symptoms, and then symptoms into disease. So that's why we look at it in that perspective.
Okay.
Mm-hmm.
Yeah. Integrating modern science with traditional healing practices, how does it benefit individuals, particularly women, experiencing menopause or hormonal changes?
Yeah, sure. As like I said before, is when we look at it scientifically, we start to look at it from a quantum perspective. That means we're looking at things from a subatomic perspective, or particles that are smaller than atoms. And then we look at things that make that up, and things that, and so we're looking at the body or the disorder from that perspective. And so we're looking at energetically. And that's why, when we use quantum medicine and science and healing, we're able to explain it. And people want to talk about this in scientific terms. They don't want to know the name of your chakra. They don't want to know the imbalance of this and that.
Right.
They said, talk to me in science. And that's the language that we learned growing up. So talk to me in science. And so that's what we do. We tell them why this is happening. We tell them why it's happening. We tell them scientifically in an easy way. And they absorb it and they love it, and they keep coming back.
Yeah. What are some practical tips you can offer our female listeners who are beginning to delve into holistic health to address midlife challenges?
Yeah, well, I would say that grounding is something you had mentioned before is really important. Walk around without shoes for 20 minutes a day, at least 3 times a week. The second most important is red light. Can't get enough of that. Red light is super important. It works on our mitochondria, where the energy is. And I actually have a red light in my studio, and we use it for people who are maybe coming down with a cold or something like that, and it can treat it right away. And
This would be like those red light masks that I've seen.
well, the whole body.
Okay.
We'll put them on a red light mat.
All
Put a
right.
blanket over them, we
okay.
put the mask on. But the most important one is we put one on their chest, and that red light penetrates to the thymus gland. The thymus gland is where our immune system is, and it gets legions of lymphocytes to start to go into work,
Right.
because they get excited and they start looking for things. And you can see them when we do live blood analysis. We can see them when the red light comes on. They just start moving faster. And their job is to engulf and take care of our cells. So, yeah.
So then for people, because red light therapy is huge, right? But I almost think that there's a very large majority of people that have no idea why they're actually using it. They just know that it's good for them.
Yeah, no, I've seen it being used for better skin,
Yeah.
like to help your face,
Right. Yeah.
for your skin.
That was never our intention with it.
Yeah.
It does. It does. And the reason why is because it works on our mitochondria, and mitochondria is where our energy comes from.
Okay.
And where our energy is, every cell needs energy, or it starts to gets tired, and it looks tired. And so when you get it
Dull.
perked up, it starts to light up. And
So how long do you need? Yeah.
I would say we need 5 minutes, probably 5 minutes a day.
Hmm.
But you can get that by doing your walks on the beach or walks outside before 7:30 in the morning.
Okay.
And you start to get that particular wavelength starts to come in really strong. And so does near infrared too, which penetrates about a few inches deeper than red light. So if there's aches and pains and things like that, it's good to get out and walk in the sun. And then, so I would say those two, grounding, red light, of course, exercise, breathing, meditation. These things are not woo-woo.
Yeah.
Meditation is not woo-woo. It has such a place.
And I'm hearing more and more about breath work too.
Oh, yeah. One of the things that we do in my lab is that we'll measure their biological age, and then you'll say that they're 5 years older than they are, and they just get really sad.
Yeah.
And I just
It would be.
go, you're a shallow breather. So what do you mean by that? I said, okay, hold this, and they would go back on the machine. I says, I want you to breathe in this section and this certain type of frequency, and they do, and they come back, and then they're 10 years younger, and they go, that's all it is? I said, yep. I said, if we breathe, we're getting oxygen to our cells, and we start to become biologically, younger. The reason why is because most of us eat a good diet, and what we're not adding to it is oxygen, because we breathe shallow. We hang out.
Shallow is in right here.
Yeah, right. And not
Is that because we're like, do we do that to ourselves by living like a busy lifestyle or by stress? And
stress is a
are we
big one.
doing that to ourselves?
Yeah, when you say that, stress is like,
Yeah.
all of a sudden, I can't breathe. But there's a spectrum of that where you can be, really out of breath or partly. And so your cortisol level's really high and you're humming up here. They said, but I feel fine. It's because they've adapted to
Yeah.
the lifestyle and they're still breathing shallow.
Yeah. I think I might be one of those. I really do. I carry a lot of tension in my shoulders.
Right.
And I think that I'm one of those shallow breather type people.
Mhm.
That's what I need to work on.
You need to know now you know what to work on.
Yes, exactly. What do you hope women, particularly those of us in midlife, take away from your work regarding the potential for improving their health?
Wow. That is, well, one of the things is learning all about quantum medicine, learning, when to do vital body medicine, which is acupuncture, massage, herbs, homeopathy, energy medicine, know when to do that, because of certain symptoms, and also know when to do meditation and yoga and neurolinguistic programming and qigong, things like that work on the mental body to calm the busy mind down and, start to filter those negative thoughts and start to bring in a more positive aspect. I hope they would learn that heart rate variability and our heart-brain coherence are super important for bypassing mental trauma. And that's something that we like to show people, because sometimes they don't know they've living in this trauma, even though it's happened to them, but it's still there, and it's
They think they've
divided.
they think I'm over that. I've gotten past that, but really
They are.
Yeah.
they aren't.
Mhm. So when you do meditation or you do qigong, you do these things, what happens is you close the busy mind and the higher states of consciousness start to flow, and that's when your body starts to heal.
Mm-hmm.
So they start to heal themselves.
Right.
And getting a good night's sleep too, because that's hard. Especially my wife had the worst night sweats, and she would go into meetings, she would sweat. She goes, this was way before I started doing this kind of work. And she, I could see how bad it was and how terrible it can be. So yeah, I was really looking for ways to, even now, to be able to help her. And doing really well.
Good.
Yeah.
That's good.
Yeah.
So if I did somebody came to see you, how does that look? Like, do we do a consultation? Do you take me through all this?
Absolutely. First, we do a consultation, and then we do a biowell scan and do what's like an X-ray of your human biofield. And then after that, we would look at your brain waves. We'd put on electroencephalogram and we'd talk about, the different brain waves. And we'd also do a neurofeedback test where we start to, like I said, when you're busy mind, you can hear the rain and it starts to decrease, and we start to hear the birds in the deepest state and open the subconscious. So we teach them how to calm the mind, how to meditate literally in 15 minutes. And so we do that. Then we'll do, depending on where I think they are, we'll do a heart math session if there's trauma there, and we show them how to bypass that. And we'll work pretty in depth with that. And then we'll do what's called a Lotus Plus. It's like a stress test, and it gives us our biological age as well. And it shows us our tension index and how much tension that we have. We don't even realize that we're our jaws are tight because all night we've been, clenching them. And we'll do that. And then we'll get to see their, what's called their autonomic nervous system, the fight or flight and the rest or digest. And we'll see, where the balance is. And a lot of times we'll see that the fight or flight is much higher than the rest and digest. And that we know that, that we have to work on that. So when we see those, we're able to get them on the table and do, we just put big blanket over them, a pillow, make sure they're comfortable. And then one of the things the biowell does, it creates tones to balance their chakras. So we play these tones, and so that vibration, that frequency is actually working while I do the work as well.
Oh, okay.
Yeah.
That's like a sound healing.
Yes, like a sound healing.
Yeah.
So a person doesn't need to book with you and be like, I want this, this, and this because I feel this, this, and this. Like, you can guide them.
I'll guide them.
Yeah.
Yeah. And the last thing I do is spinal flow. I don't know if you've ever heard about that, but spinal flow is something that was developed in Australia and by a chiropractor who uses energy medicine on the spine, right on the sacrum at the very end. There's the coccyx, and it has an access point. We call it a gateway. And when you work at energy medicine and you put energy in there, the back will start to adjust itself, and the people don't even know they're moving. I'm just watching them adjust, and their neck will move and their arms will move. And I have a great video of me doing it in Hawaii where we have 100 clients, and they were, they would come in and we'd do one after the other, and they would just adjust. And over time, they're saying that there's been, really extreme changes in their life, especially when it comes to the nerve pathways, because they hold blockages in our spine. And some of those blockages are right behind the heart. So when people go like that, and they take in that deep breath, that memory is embossed in our spine and in the muscles around it. So there's a blockage, and energy that comes from our brain, our neural pathways sometimes can be blocked or restricted. And when that happens, we try to remove those. And a lot of times, some of them is a huge emotional release. Like we'll find it and we'll hold energy on there, and then they'll just, start to scream and burst out, know what's going on.
Right.
Don't let go. And after that, they're just so, what happened there?
Yeah, right.
And they'll feel better after it. So it's really interesting to see that.
All of it's very interesting. Yeah.
Yeah.
Are you going to book?
Maybe.
I hope so.
I know I am.
Good.
Yeah. Well, thank you very much. We really appreciate this. And for you coming in and just explaining it a little bit more, because I think that there's just so much that we can learn from you and from quantum medicine. And I think just being able to educate people a little bit more on what it is that you do and what they can see you for as well. So how can people find you?
I'm at One Heart Yoga. You can just call them up and they'll set up an appointment. Or their website, you could do it as well. And I have a studio in there, and we work together and we have an apothecary as well. So we work a lot with herbs and tonics, and a yoga studio, which I promote all the time because yoga is so good for you. And especially men, I just want them, to get in and start experiencing this because, it is energetically balancing.
Okay. And your email?
It's Gary at ssefit.com, and that stands for somatic spinal energetics and fits for the Fit Mind program. So it's ssefit.com, and it's Gary at ssefit.com.
Okay. Well, thank you.
Thanks for coming today, Gary.
Yeah.
It was a wonderful chat.
Thank you so much.
Thank you. Thanks for joining us on Breast Intentions. We hope you felt seen, supported, and maybe had a few laughs along the way. Don't forget to share, subscribe, rate, and review us. Your support keeps the conversation alive. Follow us on social media for more insights, behind-the-scenes fun, and updates on future episodes. Got a topic you want us to dive into? We'd love to hear from you. Remember, life's too short for bad bras, toxic relationships, and kale you don't actually like. So until next time, stay bold and keep your breast intentions exactly where they belong, front and center. Now go crush midlife, or at least today's to-do list. Cheers!